Perspectives in Oral Health is a presentation of Tufts University School of Dental Medicine's Office of Continuing Education. Join us as we engage with leading experts, healthcare professionals, and thought leaders to unravel the latest advancements in science, dentistry, and the interconnected relationship between oral health and overall well-being. Without further ado, here is your host, Dr. Imran Hassan.
Hey, everybody. Welcome back to the Tufts Perspectives in Oral Health podcast. As always, I'm your host, Dr. Imran Hassan. And today we have a very special treat. We have the ADA president himself, Dr. Rich Rosato. Nice to have you. Thank you so much for coming.
Yeah, it's good to be here.
And you're actually a Tufts alumni, which is pretty cool, you know, having an ADA president that actually came from this university. Tell us a little bit about your journey from when you started here to where you are now.
Yeah, talking about Tufts, I think when I talk to the students, I always say I'm a D31. So that continuous learning, right? So my journey in leadership started when I first came out of residency in Chicago, worked a couple of years in Rhode Island, went up to New Hampshire, and there was a bill that was out. So I was a young practicing oral surgeon, and there's this bill at the State House that is talking about lowering the age of where a child can receive general anesthesia. So I remember it like yesterday, thinking, this can't happen. Why would they do that? These children need care. So I picked up the phone, I called the Dental Society, and I said to the executive director at the time, what can we do? And he said, do you want to testify at the State House? And I thought, there's no way. I just want to give my opinion. So he convinced me to come to the State House the next day. I went up to the State House, nervous as can be, had the chance to give testimony on why I think it was important to leave the age at 8 years old, the access to care, the population that needs that care, the inability to provide the care in somebody that age if they're not under full general anesthesia. Got a call the next day that the bill had failed. So that was my first delve into, hey, you can have success here with advocacy. You can help, you can shape the profession if you dedicate it yourself. And that kind of was the calling. That was the hook. Then I joined the CGA committee, Council on Government Affairs in New Hampshire.
I'm so glad you said the acronym because
right.
We're so frequent to say, the CGA or the ADA, but many dental students that are probably watching this might not know. So it's nice that I really appreciate the fact that you said that. And I can see that that's how you communicate with patients as well,
Yeah, so joined Council on Government Affairs, and the rest is history. Became a leader in the Dental Society, went through the board, became president of New Hampshire in 2009, 2010. I was the youngest president at the time. So it was just, I never did anything and said, hey, I want to be in leadership. I just kept saying, wherever I'm needed, I'll try to help shape the future, and we'll see where this goes. So I've had some people say to me, how are you president-elect of the American Dental Association? What did you do to get there? I just kept doing whatever was right for dentists and patients, and then it all fell into place.
That's awesome. I really appreciate the fact that throughout this time, you've been practicing clinically. Yeah. You've been a really strong presence in New Hampshire, where I also practice. I know that there was a very similar bill that happened this year, and you helped out with that as well. So tell us a little bit about how that clinical experience has shaped what you want to do with the American Dental Association.
Yeah, I think I'm asked all the time, Rich, are you retired to be president-elect of the ADA? I'm still working. I'm trying to average 3 days a week with all the travel. It's amazing how fast the time goes by. It's a 2-year commitment. I'm 6 months through the first year. It's
wow.
Click. But I think it's really important, or I know it's really important, because over my years on the Board of Trustees, there were many times where I would learn something with regards to something that's popping into mind is insurance, like maybe at the bottom of an EOB, right? An explanation of benefits to a patient. It says you should see a different provider for whatever reason. It might be that they're seeing you and you're not a participate, you're not a PPO provider.
Yeah, I don't take part in that insurance.
So you don't take part in it. And then all of a sudden I saw that, and in real time, I could call the ADA and say, we have an issue. And that's what I think is the beauty about continuing to practice. And I told myself, if I'm going to do this, I'm going to continue to practice. So I stay in touch with the issues facing us real time. And you brought up the anesthesia issue. in New Hampshire. We're trying to solve a problem that doesn't exist, and we need to be there to make sure we give our perspective for the patients of New Hampshire.
Yeah. What do you want to accomplish out of this based on your years of clinical experience? Because I'm sure you've seen the things that we could do better as both a specialty in OMFS as well as dentistry at large. I know that you came in here with goals. What are those goals?
Yeah, so you develop these over time in your leadership, and I'm going into next year as president really trying to accomplish 5 pillars. One is to be mission-based in our leadership. With everything that's going on right now in Washington, every day is a new change. Our practice can change with the swipe of a pen, right? The way we practice every day. So I try to tell myself every time I go into a meeting, remember our mission, that we're here to help dentists succeed. And at the same time, I love the friction. I love the friction of a mission statement. While we do that, we have to balance it with providing care to the patients we serve. So that's number one. Number two is to create a culture of listening. So I think in the past, people have had issues with the American Dental Association where they say, you guys love to be at the forefront, but I had an idea, or this organization is pretty good too. How can we work together and listen to every voice and make sure that we're shaping it together? Give people that opportunity. I have found that they always step up. They step up with incredible ideas. And something I always say in every boardroom is always remember the smartest person in the room is always the room. So if I can bring a lot of people together and listen to them, we trust the process. It might be messy, like things are right now. We'll get the right outcome. Thirdly, I want to work on wellness. Wellness, not from the perspective of the provider. So a little bit of a different slant. We've done a great job at the ADA really focusing on us taking care of our bodies. We're our own best asset, so we can help other people, right, in our daily practice. But we have a mental health crisis in our country. It's evident. Anybody who's in healthcare is seeing it. I had the opportunity to go up to Dartmouth Medical School and hear all of the living surgeon generals talk about the mental health crisis that we're facing. And at the end, Dr. Murthy asked last year that every healthcare professional do their part. So I'm incredibly drawn for dentistry to take its role in helping with the mental health crisis. And then to be visionary, really be visionary. That's probably something we're going to talk about today. My idea of visionary, that goes back to my Tufts days, is to really be innovative and create. We're going to talk about a task force, I'm sure, today that I put together to look at all of the things facing us in clinical dentistry.
So you kind of alluded to your time at Tufts that has shaped this idea of innovation, of being visionaries, which a lot of people say about our dean. A lot of people say that about the dental school, like independently, that, I've seen in the community. I'm sure you interact with general dentists in the community, and people say that about Tufts. I'm a transplant. I came here from an outside university. I went to the University of Florida, but ended up in New England for a whole host of reasons. What is it about Tufts that informs you about being visionary, about pushing the field forward?
For me, Tufts was such a unique experience. I'm married. My wife, we graduated together from Tufts Dental School. My older son went to Tufts. My daughter is at Tufts now. We have one son who is an outlier. We won't talk about him. He's in North Carolina, but we bleed Tufts through and through. But, when you get to this level of leadership, oftentimes you'll go and you'll reflect. So I have reflected on, part of going through the campaign was I was working with a coach who said, let's reflect on the people and things that have affected you the most. I want you to go back and think about those teachers. I want you to think about your father and mother. It was an incredible exercise to go through. And then I want you to look at the mission statements of the schools that you went to and see what helped shape you as we start to plan what will be your campaign. What do you want to talk about? When I looked at Tufts, be bold. Like, wow, right? If that is actually in the fabric of what's being taught to students here, you will see that on the outside. And we see that. We see that in the Tufts Dental students. Mm-hmm. I see it at the ADA level. So as the American Student Dental Association, a president and a vice president in the last 4 years from Tufts, that tells you that is permeating the fabric beyond the clinical dentistry that's being taught in the academic dentistry, innovate in the face of challenges. So I thought about, I had already developed my motto, and I felt like my life motto, and I live by this, is meet every challenge with relentless creativity. You can imagine when I looked at Tufts' mission and it said innovate in the face of challenges, and then to be a great citizen in the community you are. And I hope at the end of all this, I'll look back and feel like that I was able to do that to really help my community be better. So I think those are all the things that make Tufts special. It doesn't mean other places and people don't have that, but there's something we're doing right here because the results are there.
Yeah, no, I totally agree. I mean, and it's not only coming from a faculty perspective. Like, I think that the research that we're doing here is cutting edge. Like, we have a woman, Pamela Yellick, who's growing teeth in pigs right now, and I think that that's something that is just like totally revolutionary. But that's coming down the pipeline. I don't see that happening everywhere. I'm sure it does happen at all different places, but it is something that I see very frequently brought to the forefront. And part of that comes from some sort of DNA that we're developing here. And I want to, our motto is building leaders in global health. I wanted to talk about your leadership in the American setting, but also just like worldwide. Like, what do you see that's happening? Like, when we say like we're building leaders in global health, like what does that mean? What does that mean for people who are dental students, people who are graduating? At least your perspective on that.
We have a responsibility to do that, but not a responsibility to think that we do it best, right? But a responsibility to bring people together. And we talked a little bit about this. So I was mentioning this task force, Oral Health 2050. So I ran on that. The Board of Trustees at the American Dental Association has approved that. What that is I'm going to bring together all stakeholders, and we're going to look at 6 panels. So we are going to look at what will insurance look like in 25 years? What will the delivery of dentistry look like in 25 years? What will wellness look like for us? What will dental school cost and quality look like, right? It's growing dramatically. We have to innovate in that area. What will AI and technology look like? Well, you just mentioned that, the studies being done. Tufts is incredible about bringing things from the bench to the chair.
Yeah.
And then the last thing is what can we do globally to raise the oral health literacy throughout the globe, and also create standards of minimal oral health of what should be expected by all people in the world, not just in the United States. It's a great question. At the ADA, we're feeling this responsibility, and every time you drive by the front door of Tufts, you see that kind of commitment. And it reminds me, I'm here a lot, it reminds me not to forget that we have a responsibility to all the people in the world, if we can, to shape what oral health will look like.
Yeah, I think that it's something that I see very presently. I know you were talking with Dr. Sani, the director of our continuing education. She's telling you about like some of the stuff we're doing overseas to show how America is innovating and giving that to the rest of the world. But I wondered, your experience. You have the ability to look at how America is doing things great, and how the globe is doing things great, and how we can lead, both from a national perspective as well as an international perspective. So it's cool to hear that that's something that you are also going to be promoting. I did want to just double click on the wellness aspect, because that's something that I'm personally researching, the connection between oral health and systemic health, right? So there's a periodontist here. Her name is Dr. Yu, and she just recently published a paper in the Lancet about the number of teeth being connected to like all-cause mortality. So 20 to 29 teeth, 19 to 10 teeth, 0 to 9 teeth. And as you go down the number of teeth, increase in all-cause mortality, increase in likelihood for nutritional deficiencies. And so that's something that I feel like we're seeing at the academic perspective. I don't know if it's actually trickled down to the patient's perspective. And I was wondering, is that what you're talking about when you're talking about wellness, about that connection between oral health and systemic health? Or are you talking about like optimal wellness, like you should be able to chew, and this is kind of like a luxury? Like where's the ADA position on wellness? Is it more so trying to tie these like systemic health outcomes to the wellness perspective, or is it trying to tie like the benefits of wellness to the overall
I think
population?
it's all of the above. It's
Yeah.
hard. So a lot of what we do at the ADA is we're going to ask our stakeholders, all of our members, where do you want to go? We're at a fork in the road,
Mm-hmm.
right? We're really at a fork in the road right now, looking at public and private funding of oral health. I'm often asked, or I was asked once, and now it often comes up, what's the first domino to create a focus on oral health? And we can talk more about that. But I think what I would say about the oral health and the fork in the road that we're at, we have to decide. We treat 49% of all citizens of the United States.
Mm-hmm.
Is that successful healthcare?
Mm-hmm.
If you and I had to build a healthcare model together,
Yeah.
and we said, hey, we're going to treat about 49% of people will get this.
Yeah.
Is that success?
Yeah.
So I'm going to ask. I'm going to ask those challenging
Mm-hmm.
questions as your leader. Is that success? Are we truly essential healthcare? During COVID, this. A lot of people in New Hampshire were calling me. A lot of
Yeah.
people throughout New England. I was the New England trustee, saying we have to get back to work. We're essential. We need PPP. We need those loans. We need PPE. We're not even on the list, so we fought to move up to fourth on the list so we could get personal protective equipment and the loans to keep our practices open, pay our
Mm-hmm.
teams. Everyone was screaming, we are essential healthcare. I don't hear about it so much
Mm-hmm.
anymore. So the question is going to be, are we going to walk the walk on putting the mouth back into the body? Or are we comfortable with 49% of people receiving care and us being looked at as kind of like an ancillary service to medical care,
Mm-hmm.
kind of a side?
Mm-hmm.
People go in, they say, hey, I have my medical insurance. I need to take care of myself physically. But once I get to my mouth, that's kind of by choice.
Mm-hmm.
Some people can afford it, some people can't. That's a fork in the road we're at. And those are the things that are being asked in Washington right now. I think, back to the first domino, it's my belief that the first domino is for Congress to believe that oral health is essential. Once they commit to that, they have to help fund schools. They have to help fund the workforce shortages that we have right now. They have to look at a different insurance model that's broken and see how it's going to work. All of those things have to start to fall into place once they make that commitment.
Mm-hmm.
Unfortunately, we're seeing right now, current climate in Congress is going the other way, right? They cut the CDC, all of the oral health. They fired everybody in oral health in one day at the Centers for Disease Control. That sends a message
Mm-hmm.
about the respect level for oral health in Washington. And now Dr. Kessler and I and Dr. Shapiro are going to the White House this Monday.
Mm-hmm.
We've been invited to talk about the importance of oral health, and I hope we can make some ground in doing that.
Best of luck. I mean, I think that, there needs to be more connective tissue between healthcare and oral healthcare. And I feel like Perio did a great job in the, late 90s, early 2000s of connecting infection with cardiovascular disease and stroke and all these things. But I again, like, I think that the wellness aspect has been overlooked for a long time. Like, everybody knows that, having a healthy smile is inherent to your health. And it's been like that for such a long time, but I don't think we have the evidence to prove it yet. But I don't know if you have a different perspective on it. And if that's like kind of the avenue that you're going to be going when you go to Washington, what is other than like the idea of, the end stage result of poor oral health, which is like infection leading to the emergency room, that kind of stuff. That's something that we want to prevent. Other than that, is there another tactic that maybe you guys are talking about behind closed doors that, lay people like myself don't realize? Or like, what is the ADA pushing to connect that systemic health versus the oral health?
Yeah, I think we talk about opportunities, right?
Mm-hmm.
So trying to find pathways where we can help our profession move forward. So we know in the current environment, fluoride, which I don't feel we have to prove.
Mm-hmm.
I feel we should be defending it, but unfortunately, we're back to having to prove it.
Mm-hmm.
So with fluoride, I think we have to change avenues. I think a lot of people lost their job in Washington because they look at dentistry as fluoride. It's like you have fluoride across your head.
Mm-hmm.
There are so many other avenues you brought up. We can talk about inflammation.
Mm-hmm.
We can talk about, right now the administration is talking about sugar and nutrition. This is big for us in oral health. So we're going to try to find those pathways.
Absolutely.
I agree with you. Is it 100% proven right now that I can walk into the White House and say, we can connect inflammation 100% to increase cardiac disease or increase bad outcomes? I don't know if I can say 100%, but I can tell you that, the American Heart Association is connecting those dots. So we're having other organizations follow our studies, and they're beginning to talk about those things. That's the pathway. That's where I see an opening right now to move our profession forward.
Yeah, best of luck for this Monday. I know that might not be an easy conversation, but I did want to just kind of circle back onto this idea of, the fact that you're an oral and maxillofacial surgeon, which I am also. I'm very proud that there's an oral and maxillofacial surgeon that's the president of the ADA. Do you think that you have a better case, I guess you could say, because you've been in the operating room, you've seen like these like end stage issues, like I have to go to the operating room after this podcast is done to go take care of like one of those people, and I feel like I'm thinking in my head, like, I wish that everybody took care of their oral health so it doesn't lead to the stuff like this, right? Do you have that same kind of connection?
I do, and you notice I loosened my tie because he's in scrubs. So I said, he can be in scrubs, I can loosen my tie.
Dude, take the tie off, man. But it's a tough tie, so that's nice.
It's a tough tie, so I want to make sure. So I think it gives me a unique perspective. I really feel that. So let's back up a little bit and say 30%, right? Approximately 30% of all dentists trained choose to specialize. So I think it's appropriate. And I've looked at those numbers. I was asked about that on the campaign trail. And generally the presidents of the ADA run right in there. 70% general dentist, 30% specialist. But I think being an oral maxillofacial surgeon gives a different perspective on a lot of different fronts. One is the safety net.
Yeah.
We're part of the safety net.
100%.
So when we go and we talk about what it means to provide care to all people, it's not that other people aren't committed to that. That's part of our, like, what makes us us.
Yeah, part of our DNA.
Like, we're going to be there. You're going to the OR on a Friday night, 6 o'clock if I stop talking, maybe 7. And you know what I mean? That's just the commitment we make. So you can talk about that.
Yeah.
The medical side. We've been working in the medical side forever. So when people talk about, will there be a benefit in Medicare that has dental in it, we have a unique perspective as oral surgeons on how to navigate that carefully, because we know what our medical colleagues deal with. We know we have a calling to treat all people. How do we navigate that pathway carefully to make sure it aligns with our mission, that we can do both, help dentists succeed and provide care to patients? And if we can't do it, it's my job to say, I'm sorry. You have to change what you're offering to us. So I think, those are two areas that being an oral surgeon really causes a different perspective and helps me balance things as we go through.
Yeah. I think that, like, and one of the things that maybe everybody doesn't know is that, like, Rich Rosato's practice is in the capital of New Hampshire in Concord. It has a great reputation. Like, you guys are the safety net up there. And I know that because I practice in Southern New Hampshire. So kudos to you for still wearing that hat as you're advocating for it. I think that that's important. As you said earlier, let's get back to the idea of the vision, the vision that you have. Like, you've kind of said these things. What do you hope that in 10 years dentistry looks like? Like, if we had the most optimistic outcome that happens based on all of the changes that you're making right now, based on the task force that you're making right now, what do you think is the promised land for us?
Yeah, I think if we can navigate this correctly, we're heading for the greatest era in dentistry. And I know you probably have heard other things like, it was 1940 to 1990. I really don't believe that. I think if we can navigate the pathway to creating oral health as part of overall health and create that essentialism, and then shape it with insurance and shape it with the delivery model, we're going to be able to treat more patients. If we drove utilization to 70%, that would be so successful. But how do we do that? How do we treat millions of more people? We have to look at the dental team, and we have to change the insurance model. The insurance model that we use is not insurance. It's a defined benefit plan. We have to figure out, can we change the insurance model and still maintain that success that we deserve after an 8+ year education and the cost burden to many people associated with it. And at the same time, my hope would be in 10 years, we have a containment of the cost of dental education and create a standardization on what your minimal education should be. So people coming out of dental school have at least that minimal standard. These are the things that I'm called to put in action. I won't be able to see it to the end, but they're really important to me.
Yeah, I really like that aspect on education, because here we are at a dental school. I mean, I'm sure you hear the dental students talking in the background, so sorry about that. So the reason why I wanted to bring it up is because this whole idea for this podcast came from getting different perspectives from people. Like, I think that when I was coming out of dental school, I didn't realize the whole dental ecosystem. And you're talking about how you kind of fell into it when you were asked to advocate on the behalf of something that was important to you, and people might not know enough about organized dentistry, and so now you've given them a unique perspective. What else do you want to say to those dental students or the people that are listening to this, that are looking forward to a career in dentistry? Like, what would you advise them to do, if you were able to advise them?
Yeah, I I can't not say be ethical, right?
Mm-hmm.
Have ethics at the forefront in every decision you do. You know, after being here or being at an accredited dental school, that you're going to have an ethics standard that's given to you. Follow that, and the ADA is there for you to help you through that. The second thing I would say is lift each other up.
Mm-hmm.
Dentistry can be really solo. It
Mm-hmm.
can be really lonely, and we've always had that issue in our profession.
Mm-hmm.
I think when I talk to the current students, they already have this,
Mm-hmm.
right? But a lot of times, I was solo practitioner for so many years
Mm-hmm.
until recently. There were times you feel lonely,
Mm-hmm.
and it's okay to not be okay. And if you lift people up, lift while you climb. So whether it's me advancing the president or you say, I'm going to do this podcast, as you rise up and what your goals are and your pathways you find, lift some other people with you. It'll be very rewarding. And if they do that, they're going to have an incredible career. I spoke to them yesterday. We did a lunch and learn here at Tufts, and there's lots at ada.org. If they go to that website on financing, helping with their student loans, looking at wellness, and a whole slew of offerings that not everybody knows.
Mm-hmm.
So, thank you for bringing that up, giving me the opportunity to talk about that.
Yeah, I think that, like, if I were to look back at myself as a dental student, I think my focus was like so different at that time of my life as what it is. Like if I were to tell myself, listen, you're worrying too much about X, Y, and Z, like you should focus on A, B, and C, And I love the ethics comment, because I don't think that, like, I realized afterwards how much, and especially in the OMFS community, like, if somebody in North Carolina has an issue, then it affects us, if somebody in California has an issue, then it affects us. And a lot of that comes from the public's perception of our specialty. And I think that it is true for dentistry at large. I think that there is this, there is this sentiment that's out there that people feel like, just like you said, that this is like an optional treatment, that they may just be doing this to get money out of me or something like that. And I love the fact that, like, you should be proud of your profession, that we're helping people every day, that we do provide a unique service to the community that is not something that everybody has the opportunity to do. There's multiple other professions that you can't look at the end of the day and say, I help somebody. And I love how you started with that ethics comment, because I think that is super, super important to be stressed as that's like the first thing, right? That outside of that, like, there's this whole other ecosystem. There's DSOs, there's technology companies, there's, dental corporations that are selling dental supplies, and I wonder, like, how much of that would you say is uh, something that a dental, like, any of those particular stakeholders that you would say, like, hey, listen, like, this is something that you should see that's coming down the pipeline. You are and I are living through, like, what I would consider to be like the era of implants, right?
Right.
we're all doing well because implants are such a unique opportunity for us to help someone, as well as they're very, very lucrative, right? And I think that like in the past, orthognathic surgery was a big thing for us, and I'm saying this from the OMFS
Yeah, yeah, that's
perspective, because like
yeah.
it's like an outside timeline, but there's also timelines for dentistry, and I feel like we're living in the DSO, um, the age of the DSO, or at least everybody's concerned about the DSO, right?
Right.
And most starting grads will start their time out at a DSO, at a dental service organization, which is something that is an acronym that everybody should know about. But the point that I'm trying to say is like, what what of those things would you say, hey, listen, like this is something that's coming down the pipeline, it's a stakeholder right now, and it's something that's going to be very important in your life. I think that we met at the DenTech conference,
Right.
and so technology is going to be a big thing. But I would love to hear your perspective on which one of those stakeholders are you think that are important for dental students to know about. Which one of those stakeholders do you think will have like a huge impact on their life, and also like some things that you would the questions that you would be asking if you were engaging with those.
Yeah, one of the advantages I have being at the ADA is we have a whole group of economists
Mm-hmm.
that look at trends. So I would say to a student, another thing I would say to them is just commit yourself to a life of learning.
Mm.
Ask the questions, innovate. You're going to arrive to a place in your practice or in your financial choices of practice model, where you're going to have some choices, and you might want to throw your hands up and say, I don't know what should I do here? Just keep learning. And in dentistry, we're blessed. Most of the time it works out perfect. You end up being as successful as you choose to be. But the trends, let's talk about the trends. That's
Yes,
the heart of your question.
Exactly.
So the first trend that I would want students to know right now is payment models. The patient mix is changing. So we are seeing a leveling off of private insurance payments, and we're seeing an increase in public programs. And we need to know that. We need to figure out how are we going to navigate that. So I'll give you the numbers. In 2023, that's the latest numbers we have. Dental spending that year in the United States went up $4 billion. All right, cool, right? Everybody's like, yes, that's what I want to hear. 100% of it was public. Medicare, Medicaid.
Mm.
3 billion of it was Medicare. So you might say to yourself, the people watching, how is that possible? We don't have a dental benefit in Medicare, but we have provisions in Medicare, especially in OMFS,
Mm-hmm.
right? Where someone needs radiation therapy, we can now go in. We used to do those cases for free.
Mm-hmm.
Or somebody needs a heart valve replacement, you might go in and say, I've got to take out these couple of teeth, whether they can pay or not. Now we get paid for those.
Mm-hmm.
And we're saying we don't 100% know, but we're pretty sure that the whole $3 billion in Medicare is because of those provisions. So that's number one. Without getting into the weeds, we have to watch the patient mix that's going to provide for the income to the dental practice. The second thing you talked about is dental practice model choices.
Mm-hmm.
We know we've followed for 20 years. So it is amazing to me. Sometimes I'll talk to somebody and they'll say, but I think that trend's going to change. But we've been following since 2005, and younger dentists don't want to own their own practice anymore. It doesn't mean that they want to join a practice that's private equity owned,
Mm-hmm.
but that's okay too.
Mm-hmm.
We have to support each other. Like I talked about, lifting each other up, supporting every dentist, because as you said, many people don't stay in the same practice model. You might be solo for a while, and then you might join 3 practices together. So we do know that the trend is over the next 5 years, we are going to see many more dentists will choose to practice in a group setting. That could be small group, medium group, large group, private equity backed group. But we know that trend is here as we watch people who want to practice alone. When I say solo practice, I mean one dentist, one practice. That is decreasing as the older population moves off the map of and retiring.
Yeah.
Those are 2 big trends students need to know. And they need to know it's okay if you make a choice and after 5 years you want to move,
Yeah.
you move, and we'll support you.
How do you feel about the private equity inclusion into dentistry? Because I feel like that's something that is like a relatively new occurrence. Like it's not something that I really knew about when I was in residency, but it seems like everybody's talking about it, and it's something that even dental students are talking about, you know?
Yeah.
So, I mean, I think that there's pros and cons, but just wondered your insight
Yeah,
on
I
it.
would say two things about that. One is I
Mhm.
always try to be careful and say, if you see one practice, you see one practice.
Mm-hmm.
You run your practice different than mine. As a every private equity backed practice is different.
Mm-hmm.
For me, the way to unify it,
Mm-hmm.
I've thought a lot about this, and that's why one of my goals is clinical autonomy,
Mm-hmm.
and is that if we can create a standard of clinical autonomy, so regardless of the practice model that you're in, because I've heard when I was chair of ethics for the ADA,
Mm-hmm.
we had a ethics hotline,
Mm-hmm.
and we would hear complaints from solo practitioners putting financial requirements on their associates.
Mm-hmm.
And then corporate dentistry was just beginning, like you said, 2014, 2015, and we were hearing it there too. I think it's important for the ADA and for dental societies across the country, state dental societies, to make a statement in their code of ethics that we are going to support clinical autonomy as a core value. And that means that nobody, no entity, no individual comes between a dentist treatment planning the best treatment plan for that particular dentist. Protect the sanctity of that relationship in the operatory.
Yeah, no, I love that. And I don't know how much is just, you know, things that people talk about and how much is like you're actually seeing, because you guys are governing the boards, you guys are governing, you know, everybody, right? Like, so it's super important for you to be on top of any sort of difference in standard of care, you know? And I just know from the medical aspect of it, you know, with private equity introductions, they have, you know, very clear evidence that standard of care will go down. So I'm glad that there is somebody that's kind of a watchdog when it comes to that kind of stuff. But it's nice to hear that, you know, if a dental student were to go into a private equity situation, that the standards of care are still being held high.
Yeah, and we don't have governance over licensing boards in each state because they have a different charge to protect the public.
Sorry about that.
So no, it's okay. It's important though. I knew what you meant. You meant governing, state societies were tripartite, but I wanted to make sure that I would like to see licensing boards, if they're seeing trends that we can help solve.
Mm-hmm.
Well, I know they need to maintain their arm's length, but if they're seeing trends and they put out those reports, then at the American Dental Association and then permeating down to the component level, we can begin to talk about those trends. Because you're absolutely right. We know that there's been some stuff happen on the medicine side that we just want to be careful about. We have the opportunity to learn from that.
Yeah.
Where did it work well? Where did it not work? And how can we protect our profession moving forward?
I think that, you know, moving forward, I do agree with you that, you know, we are looking at what I would consider to be a golden era of dentistry, just from a demographic perspective. All the baby boomers are getting to an age where they need a lot of dental work. A lot of them are coming from an era where they may not have had the best dental care, and it's up to us to give them the quality of life that they should have. I wanted to end on just like the idea of optimism, which is, you said that this was, you know, you think that we're going into the golden era of dentistry. I just want you to just kind of tell us what do you mean by that? Is that something that is just from um, a better pay for everybody, better clinical standards for everybody? Like, what I see all this technology coming that will hopefully make our lives better. But what is your perspective when you say that we're entering into this golden era of dentistry?
I'll start. I agree. I want everybody to feel really good about the profession that they chose. Things that have been happening that should excite folks. Day before the inauguration, right? American Dental Association puts on the back page of the Washington Post a call out to make America healthy again, and that oral health needs to be a part of that we are part of overall health. Dr. Kessler and I, in last month's JADA, put out an editorial, take a look at that, talking about where are the opportunities in Washington through advocacy that we can connect and create opportunities and drive our profession forward. I would ask everybody listening, when was the last time that you saw dentistry and oral health be at the top of the conversation, even to the presidential level?
Yeah.
So there's the opportunity. there's the opportunity to really convince them that oral health is important, that the public can be educated how important their oral health is, and we can drive this narrative. We have the door open in front of us. We've got to walk through.
Yeah.
And I, in my 30 years of practicing, I haven't seen that opportunity yet.
Yeah. Yeah.
So
I would love for that to happen. I would love to be on the forefront of people's minds in the same way that, like, neurosurgery is on the forefront of people's minds when they think of, like, medical specialties or things like that.
Right.
And I think the dentistry, it plays such a vital role. And best of luck to you in promoting this idea of the future of all of us,
yeah, I appreciate you giving me the opportunity to
Yeah.
talk about this. It's good to
Yeah.
sit with you.
So
and,
nice to see
yeah,
you,
same,
man.
same.
Yeah.
Really
And
good.
it's, again, another Tufts alumni. So for anybody who's listening, this could be you one day.
Yeah, you can do it.
Yeah. Yeah.
Yeah.
Thanks again,
So,
Rich.
yeah,
Very nice
thank
to
you.
see you. Yeah.
Thank you.
And thanks again, everybody. As always, if you could like and subscribe, it would mean a lot to us. And always check out our continuing education offerings. Thanks, everyone. See you next time.
Bye, everybody.